I'm Nancy Dykstra, and I am Executive Director of the Community Health Center here in Sioux Center. That's what speaks to people's heart the most, is to let them know how we impact people's lives. So
it's a place where people can come and, without insurance, people who don't have insurance at work or insurance at all, we offer, a low cost so they can bring their children and themselves, because if we didn't have this, most people, if they don't have insurance, they don't go to the doctor.
As a patient, you get to see the care that's being delivered here, and that's the thing that I see that we hear over and over. It's about the patient care here that people are receiving, and the care I have received here has been excellent.
Yeah, I think myself as well as all the other employees here really just believe in the health center in general, and not only are we patients here ourselves, but we also love to spread the word. And it's a great place for anyone to get care, not just people that don't have insurance.
Or through the medical side, people are finding out dental. So they kind of go hand in hand, and, they're both important, oral care and health care, So people are kind of able to not just get one service, but another one offered to them, and still at a reasonable price or what they can afford.
Well, I'm not on insulin no more, and I'm down quite a ways on pills.
Mm-hmm.
It's a 3-day, and it's only 2. And then lost about 160 pounds. One of my diabetes medicines was thrown away too low, and she took me off that right away.
I see that a lot of times, sitting up front watching patients come in who are unaware of all the services that are available to them. And that's a big part of what the health center does.
A lot of them would put money as one of their main options sometimes, or reasons why they don't get the care they need. A lot of times, like I say, it gets to the point where they don't go in unless they have to go to the emergency room, or they it'll pass, or it could be something serious that they're probably not detecting. And it's always best to get it from the beginning, because then you're avoiding a lot of financial and emotional and physical difficulties down the road.
It gives people hope too that they can be healthy. I've seen it change lives. We've had children come in here that have cleft foot at the age of 5 that no one has caught yet. We've been able to get those people services, and to the Shriners Hospital to get services.
What nurses do is advocate for their patients, so that definitely includes going above and beyond just their health needs.
I've seen a lot of people just, go from bottom to top, whether it be physically, emotionally, economically.
We get a lot of patients who come back because, they like, the fact that we have people who interpret for them, and they like the providers here, and they like the fact that they listen to their concerns, and we're able to, communicate back and forth.
We have a back-to-school event every year, and we had a little boy come through this past fall that had been in Mexico before he came to see us, and he had undiagnosed heart problems that we were able to get him care in Sioux Falls for, and now he's a healthy kindergartner and just as full as life as can be.